As a doula and a childbirth educator, I get a lot of questions about cervical exams that are done in your doctor's office or your midwife's office at the end of pregnancy. And that's what we're going to talk about today. Now, if we haven't met in real life, my name is Alice Turner. I am a doula, a childbirth educator, and on my channel, I talk about birth. So if that's your thing, hit the subscribe button and you'll be notified next time we put on video. Today, it's all about cervical exams. We're going to cover some of the most common questions about cervical exams done prior to labor. Now, I do have another video that goes more into depth about the cervical exam. It's also called a vaginal exam. You might hear it called a pelvic exam. You might hear it called a cervical check. But for more information about that check and how it's done, check out this video for more information. So a lot of care providers, your doctor or midwife, will do a routine cervical check at your appointment leading up to your birth of your baby. So that might be your 36-week appointment, 37, and so on. Now, the big question is this cervical exam necessary? The answer is no. This check is not necessary. It does not need to be done. So you might be asking, why is it done? Now, the reason that you might hear from your care providers that a cervical exam is done in late pregnancy or at those late prenatal appointments is to really see if your body is doing any prep to go into labor. So during that cervical exam, they might see that your cervix might have started dilating. They could tell if your cervix has started effacing. So they can see whether your body has started some labor. This is also a time that they can check the position of the baby. So they can feel often if the head is head down during a cervical exam. Now, is this the only way to check and see if the baby is head down? It's not. So something called the Leopold's maneuver, they can touch your belly. They can see if baby is head down just by palpitating your belly. They can also do a Doppler and check and see where they're hearing the heart rate the loudest. That can usually give them an indication of the position of the baby. They can also do a ultrasound to see the position of the baby. So a cervical exam is not necessary just to find out position of the baby. Let's go back to finding out if your body has been prepping for labor. So a good question might be, hey, I'm dilated. Does that mean that my body is prepping for labor and you can predict when I'm going to go into labor? Nope. You cannot predict when labor is going to start just by how your cervix is presenting at that cervical exam. Here's a real example. If you go into your appointment and find out your cervix is closed and hasn't started facing, no change has been made to your cervix, does that mean that you won't go into labor that night? Nope. You could go into labor even after the appointment. It does not indicate when labor is going to start. What if you go into the appointment and find out that you're 2 or 3 centimeters dilated? You might get really excited and think this is a prediction that labor is going to start any minute. Is that true? Nope. Doesn't mean that's true either. People can stay 2 or 3 centimeters dilated for up to a week, 2 weeks, for a long amount of time. Cervical checks do not predict the future. They cannot tell you when labor is going to start. What they can say is your body has started making some change or your body hasn't started making some change. But it doesn't change anything as far as when the baby is going to come. It does not predict anything for when the baby is going to come or when your labor is going to start. What can happen, it can change your mindset and how you're feeling about birth. So I've seen this so many times where clients get very disappointed when they feel like labor is going to start and they go to their provider and find out their cervix hasn't changed at all. And so they get very depressed and sad that labor isn't going to start anytime soon. The other has happened where people have gone in and found out their cervix has started changing. They're 2 centimeters dilated. And then they get so excited because they think, this is it. and then only to find that it's going to take days and days for labor to start. So it doesn't predict, and it isn't necessary to tell position. So you might be asking, what's the harm? Why does it really matter? Well, for a lot of people, a cervical exam is painful and is something that is an uncomfortable procedure that they really don't want to have, and this is valid. So why is a cervical exam done prior to labor often more painful than those exams that happen in labor? And it's all because the position of the cervix. The cervix, when we are pregnant, is pointed way back. It's pointed to our posterior. And what this means for the cervical check is that it might be more difficult for your care provider to reach the cervix because it is situated so far back in the vagina. So a cervical check prior to labor starting often, for many people, is more painful than those that are done in labor. And so if you're someone who isn't looking forward to a cervical exam, finds it painful, you do have options. So you might be thinking, how do I avoid this? So my best suggestion for avoiding a cervical exam prior to labor is to talk to your care provider. Have a discussion with them about your preferences. Have a very open, frank discussion about what you want and ask them why it is necessary or what your options are for having a cervical exam. Now, I suggest having this discussion when you are in your regular clothes. So you feel very vulnerable if you are in that paper gown, partially dressed, and you're trying to have a frank conversation about your preferences for a cervical check. So if it is your appointment and you get put into a room and your nurse says, here is a gown, go ahead and change. Your doctor is going to do an exam. Go ahead and go into the room, but wait on getting into that paper gown and let your nurse know that you'd like to have a discussion with a doctor prior to getting undressed. This is how you are keeping your own control over that conversation and having it before you have the exam that you don't want. So it's always you have in your power to change or not change. So have the discussion when you have your clothes on, and you will feel more confident in expressing your desires and have a good discussion with your care providers about your options. Sometimes people ask, my providers say that I'll get a cervical exam when I have my GBS test, which is usually done at my 36-week appointment. Is a cervical exam necessary for the GBS test? Nope, that's not true either. So the Group B strep test, to find out whether or not you have the Group B bacteria in your vagina, that is a swab that's done on the outside or slightly inside the vagina. So it is not something that comes near your cervix. So a cervical exam is not required during a GBS test. Those are two different things and very different procedures as well. That is not necessary. So the last question that I often hear is, what if I want an exam? I'm kind of curious what's going on. I really want to know. I've been having some contractions. I've been seeing some mucus plug. I've been seeing some bloody show. I want to know whether or not my cervix is changing. Can I request a cervical exam? The answer is yes. You have the ability to agree or disagree with a cervical exam prior to labor. So it's absolutely something that you can talk to your care provider and express interest in the exam. So you definitely have the power to request a cervical exam and agree to an exam prior to labor. I do recommend that you talk about risks of the procedure and go into it with an open mind, knowing that it isn't a prediction. So either way, you won't be excited or disappointed depending upon what your body is doing, because like I said earlier, it can change at any time. So now you know, cervical exams done prior to labor are not necessary, though you do have an option if you want to, though they don't predict labor. Now, if you found this video helpful, hit the like button. That way more people can find this video and share the same information. And I hope that you have a great day. Enter a comment. I love to read them. See you next time. Bye, guys.